Good afternoon and good evening, and also, in some places it is already good morning. Like there are also some friends in, from Latin America. So far we already have near about 150 participants. So we are still waiting that there will be some more joining. Okay, there are many in the waiting room as well, but coming in. So meanwhile, we will, start our webinar, and I would like to, introduce our moderator, and then I will hand over to her, and she will take the webinar ahead. Yes, so here is our moderator. Her name is Aloka Guha. She is the founder chairperson, okay, for the National Trust, okay, for the welfare of persons with disabilities, okay, with autism, CP, MR, and multiple disabilities, okay. And it is actually a statutory body of under the Ministry of Social Justice and Empowerment Government of India, okay, based in Delhi. Okay, she is also the controller of examinations, Rehabilitation Council of India, we call it RCI. RCI is a statutory body of, autonomous body under the same Ministry of Social Justice and Empowerment of, the Government of India, which is again based in Delhi. She's also the technical officer for the mental health and substance abuse unit, okay, which is by WHO, World Health Organization, okay. And she has quite a lot of experience, more than my age, 45 years of experience exclusively in disability sector and the development sector, okay, in teaching as well as training and as an admin and policy making and evaluator, okay, and monitoring and mentoring. So presently, she is chairing several committees of Rehabilitation Council of India and the National Trust, both under MSJE, the Government of India, 2019. Okay, she completed a teacher's manual on inclusive education, cross disability, along with five other teacher authors as part of the project RAISE, which is going on in Northeast India. The project was from 2014 to 2018. She is also consultant for Saksham Tripura, okay, Department of Education, Government of Tripura, which is in India. And she's chairing task force on inclusive education set up by the Department for the Empowerment of Persons with Disabilities. Again, it is Government of India. Okay, she's teaching B.Ed and M.Ed students. She also is training general teachers on inclusive education. Okay, participating in several webinars on RPWD, the Rights for the Persons with Disabilities Act, which is published in 2016, and NEP 2020, and inclusive education. So there are actually a lot more details, and a lot of the things were mentioned, but we have cut short and made into just to just introduce her to all of you. And dear Aloka ma'am, we invite you to this webinar as the moderator, and here I hand it over to you, and please take it forward.
Thank you, everybody. Such a pleasure to see so many of you from different parts of the world. Certainly, COVID has made us into a smaller world, more relevant in terms of important things. So, I'm going to invite Reverend Dr. Matthew Abraham to open and inaugurate this webinar.
Thank you, Aloka.
May I introduce you, please?
Yes.
Yes, he is the chair of CHAI, Catholic Health Association of India. And as I mentioned, he looks too young to be the chair, but he's also very passionate in this situation with 10 years of leadership in Canada Catholic healthcare. He served as health secretary, Catholic Bishops' Conference. He is the chairman of the Technical Resource Group in NACO and currently president of Christian Coalition for Health and chair of Link Asia Network. Father, thank you for organizing this, and I welcome you to start the proceedings.
Thank you, Aloka, for that brief and lovely introduction. Well, I would say the story before I formally welcome everyone. I'd like to say something about Lillian Phones and also Link. It all started maybe 45 years ago when Liliane Berkelmans came across Agnes, who had a disability, and that act of compassion or that surge of compassion has led to this great organization, Lillian Fonts. So I stand here with today. I'm here with gratitude to Liliane as well as to Lillian Fonts for all that great things that are happening all over the world. A few years ago, Lillian Fonts brought us together, partners of different parts of the world, mostly Latin America, Africa, and Asian countries, and formed this link network, Lillian Inclusion Network. The whole idea was to leverage the strength of all that had been happening over several years in these countries, leverage the strength of the partners, and also make a difference in the lives of the children who are cared by these partners. So one of the main objectives of this link network was learning, and learning not just for the sake of learning, but also learning to make a difference in the quality of the life of those children and youngsters who have disabilities. And today, this dream has taken a different dimension. So far, when the COVID restrictions were not there, this learning was happening locally. Now today, I would say that even though COVID was challenging, this has become an opportunity, and it's amazing to see people coming together from all over the world, especially Africa, Latin America, and Asian countries, to learn to improve the quality of life of the children. So, with that brief introduction, let me welcome all of you into this meeting, especially the speakers. I'm not going to talk about them because Aloka is there to introduce them. A special welcome to Stephen. Stephen is, um, I don't want to say many things about Stephen. Stephen, you are a great leader. You're a great inspiration for all of us. And we are grateful that you are able to join for this meeting in spite of all the commitments there. So thank you for coming today. A few instructions about this platform. We chose this particular uh, Zoom package where we can see each other. Now, there is also a webinar package we see only the speakers, but we felt that being part of a network, a family, it's good to see each other. So that's why we chose this. So some of the difficulties of this challenge of this package is that um, we have to mute everyone, otherwise there can be disturbances. So we have muted all of you. When it comes to discussions, you will have to raise your finger, or you will have, raise the hand. There is a icon for that. Or you will have to send your questions on the chat. We'll identify, and so you will keep muted till the session is going on. But your video can be unmuted. So please unmute all your videos so that it's good to see each other. So with that brief instruction about the platform, um, I once again warmly welcome you. Thank you so much for joining. Back to Aloka.
Thank you so much, Reverend Father Matthew. I now welcome Stephen. to give a brief address.
Thank you very much. Dear audience, dear friends.
Yes.
Can I introduce you, Stephen?
Oh, sorry, first one introduce. Okay, great. Yes, please.
Okay. Um, he's a member of the board of directors of the Hoogstraat since 2009, and that is a long time. He's worked with them for 27 years as child physiotherapist and division manager, manager of knowledge center, and director. And I would now request you to please make your presentation or say a few words.
Thank you very much. Yes, dear audience, dear friends, dear colleagues of Time, dear Father Matthew. I speak to you from my house in the center of the Netherlands. The Netherlands is still in a sort of lockdown because of COVID-19. Lots of people work from their home, like me today. Thank you all for inviting me to give, as Thierry asked, an inspiring start to this webinar. For me, this task is already successful because I feel very much inspired to be part of a meeting dedicated to the important theme of how to manage children with disabilities in times of COVID-19. Today, you will be professionally inspired by a lineup of high-level presenters from beautiful Vietnam, my dear friend Tui, from lovely Indonesia, and from authorities from impressive India on special education and on autism. With this lineup, this webinar is an excellent example, Father Matthew talked already, said something about it, of the possibilities of the Liliana Inclusion Network. Link, a network designed to make it possible to learn from colleagues across borders and despite cultural differences, all for the sake of people, children with disabilities. Here gave me just a few minutes, and I want to spend my remaining minutes on two topics. First one is work-family center. As you know, the World Health Organization adopted the model of International Classification of Functioning, ICF, as the method for classifying the abilities from and the levels of support for persons with disabilities. The environmental situation is an important factor for the level of ability. COVID-19 created a sudden change in the environmental situation, which will have impact on the functioning of families. For children with disabilities, counsel that no result can be reached without notice and examining of the parents. Same counts for family members from adults with disabilities. Find strategies to support families, to support and educate parents, to make them the strongholds for people with disabilities stronger. A second message is especially for you. Stay safe. One of the first duties of a health worker, even a mobility worker or a field worker, is to stay safe and just protect herself or himself. In this pandemic, this message is more important than ever because when contaminated with the virus, not only you as a health worker and your patients are at risk, but likewise will count for your loved ones when you bring the virus home. So enjoy the webinar, teach your peers, learn from them, and feel inspired and energized. And back in your work environment, support families, support parents, but first, take care of yourself. Enjoy this webinar.
Aloka, you are on mute. Aloka, please unmute.
Muted. Okay, here we are. Thank you so much. Both of you took very little time and very much within the schedule, but you did manage to highlight the important parts. Uh, what I would have to say in terms of this, that in India, we found the first month to be quite chaotic for everybody, not just persons with disabilities, but persons without them. So, whatever affects persons without disabilities tends to be aggravated in the instance of persons with disabilities. So, those are further exaggerated, exacerbated, and certainly highlighted. Although by the second month, the government of India started talking about special provisions for persons who were elderly, persons who were sick, and persons with disabilities. I took at least a couple of months before food, essential items, and some online essential services, including education, started reaching persons with disabilities. The positive side of it is that there's been a lot of time for professional development, including this one that we are in now. And by the end of the second month, there was a lot of teacher capacity building, both of special educators and general educators, in trying to reach the children who were home based and, in any case, at home. Obviously, in rural areas, we found very difficult to reach, but overall, there has been similar issues in the entire country, particularly in the Asia Pacific region, in terms of mental health. And there was this father here in Kolkata who was so angry with his son who had an intellectual disability and who would refuse to wear a mask or wash his hands too often. The father strangled the son to death. And it really woke all of us up into the issues of mental health that affects all of us. But yes, I am told that 45 lakh, that's over 4 million children with disabilities are not able to access online learning, and that's a huge amount. So, special teachers have modified their learning and therapy. The kids are missing school. They're so unhappy with the routine, particularly children with ASD, somehow find it very difficult to handle the new routine of home, which was meant for play, now becoming both play and learning. So these situations have been very difficult. And I'm sure you will have the same experience. I just wanted to say how happy I was to be part of a Liliana Pond project called RAISE, Regional Action on Inclusive Education in the Northeast, where five states, state board books were taken in terms of English, um, maths, uh, environmental science, and science. And there were six of us who sat down over a period of 2 years and adapted the curriculum to suit the needs of children with all disabilities. This was the first of its kind in India. Earlier adaptations looked only at visual impairment and hearing impairment, and very little was available for those with intellectual disability. But we looked at all of the disabilities and made a lot of adaptations, which has now been taken over by a part of the Ministry of Social Justice and Empowerment and Department of Disability. They have a body called the Rehabilitation Council of India, and they've taken over this content material covering class 1 to 8, 4 subjects, lots of adaptations. So I really have been happy to have been a part of that. We learned a huge amount ourselves and were able to capacity build both general teachers and special educators, uh, bring them up to a level where more and more children are being meaning significantly included, not just in physical access, but also in curricular access. And our new national education policy has made this effort even more relevant in bringing, which is, the policy is based on equity and access and equality. It's a beautiful document. So this manual that was developed with JBS and Liliana Fund has gained that much more meaning and significance in the new matrix of education, which is inclusive and equitable. So I want to thank them for having given me this opportunity. And now I'm going to invite Weni to make her presentation, and I'm going to introduce her to you. Weni, sorry, 1 minute, yeah. Weni has been educational specialist with the Perkins International Asia Pacific Program for Indonesia. And she's particularly passionate about problems and challenges that the children with disabilities have faced during this COVID time, along with their caregivers. And she's going to talk about some of the very innovative practices that they have undertaken. Presently, she is working with Perkins International. Previously, she used to work with Opportunities for Vulnerable Children, Helen Keller International Indonesia, and a lot of research and development and work has been undertaken by her. She used to be Assistant Director of the Asian Pacific region for assessment, program planning, and project execution. She has established 9 early intervention programs for children with visual impairment and additional disabilities in Indonesia. Worked very closely with family and communities, and most importantly, perhaps, she has established very good partnerships with the Indonesian Ministry of the National Government. Weni, I invite you to make your presentation, and I look forward to listening to you, as we all do.
Thank you very much, Madam. Thank you. A very good morning, everyone, and good afternoon, probably for some of you. It's very nice to be here, and thank you for the committee to invite me to share in this very important place.
Vinny,
So yes, I would like to.
Vinny, excuse me, can you speak a little
Yes.
louder to the mic? You're not very
Oh,
audible.
okay. Okay. Is it better now? Hello?
Yeah, better, better. Go ahead.
Better? Okay. Okay. Thank you. Okay. Good. So yeah, I would like to start this presentation by showing you the map of Indonesia. I'm sure that some of you know, but this is also part of our challenge of really kind of reaching and working with children with multiple disability, particularly in this situation where our children are really kind of left behind. The COVID-19 arrived in Indonesia in early March, and the government decided to close all the school and institution related to the kids and education in the second week of March. And uh, next slide, please. Yes. So based on our experience throughout the region, where actually children with multiple disability, and these are what we actually learn, that most of the children are actually at home and actually unserved. And those are about 60% children with multiple disability are not receive any education or a service. And then about 15% children, they are at school, but may not receive appropriate education. And the 15% or maybe in the orphanages or in other welfare institution. And about 10% they are in the CBR program. According to the Ministry of Education and also Ministry of Health for the data for the year 2016, next please. There are about 590,000 children with multiple with disability, and almost 40% of them having multiple disability. And even really kind of most shocking is that 98% of them, they're not in a school. And in this situation where everybody really kind of having such difficult time, and also a lot of problem that we are facing, as Madam Aloka said before, there are a lot of things that we are facing, and this is what we could gather from our partner right now. Although before we have some movement to find the child, but right now it's really this activities is really cannot being done. And last July actually supposed to be the new enrollment for children to be in the school. And for some children, actually for some children with single disability, they manage to enroll in a school, which is actually only done by online. But for the children with multiple disability, actually this is really kind of difficult. Although not all the school refuse them, but parents also kind of not really kind of confident to come to the school and also to say that my children has multiple disability. So the new enrollment for children with multiple disability are really dropped. And other things that facing really kind of lost the connection to the school or to other service provider. Some of them really kind of, because they really live far away in the rural area, which not the infrastructure is so weak, and they don't have the communication devices or such as the internet, so that the school or the CBR or the other provider cannot reach them. And in addition, a lot of children who used to be like living in the institutional, and they send to home, and they really have the lost connection with the service provider, and they are risk of possibly a dropout. Next, please. Next, please.
Yeah, it's process.
So next slide, please. Okay. So I'm going to talk also about the challenges that child face, and also the caretaker face, and what we are doing actually to face that. First, that as we know that our children actually depend on the routine. They understand probably some of the routine that have been happening before the COVID, when the children really waking up in the morning and when they go to school, or maybe meeting to the CBR um, um, staff, and then have such activities that are structured. But now those is really not happen. A lot of our kids actually don't understand about what is happening, as many of them don't communicate verbally, and changing is such really kind of difficult thing. So they don't understand what is happening. They're meeting like, oh, why I'm not at school anymore? Why I have to wear mask? Why I have to wash the hand, and why I have to do all the protocol, why the teacher that I met usually is right now I cannot meet again. Do they met or at me, or this kind of thing that's really confused the children and really affected a lot of things, and it could be really kind of lead to the behavior which we really don't want that happen. So our children also kind of only have like a small social circle, which usually kind of people like CBR staff or the teacher, but now they don't have that. Those people who may understand their communication, those people who may understand like how to interact with them. And a lot of time when children, particularly for them who are in a school, the family don't have a really kind of capability to really use the communication as the teacher actually using. In Indonesia, our situation that a lot of our kids do not have the kind of, do not introduce with the technology, so that in this time really kind of they don't have access to know about what is happening outside their house. They only know it's being kept at home, but they do not know why. And again, that's make a really kind of challenging. And a lot of our parents reported that the children have such a behavior right now. Next, please. So what can we do to face to help our kids? Should be to the next slide. Okay, so I have to really actually thanks to our colleague from India, and also my mentor who surprisingly, she is here, Dr. Namita Jacob, who actually made a very beautiful guideline about how to keep the student, the children, with the structure, with the routine. And you can check actually to this link in the slide. And those are already in the different languages, like in English. I think that is supposed to be in Hindi, also in Vietnamese, Chinese, Japan, and other languages. So there's very beautiful things that the parent in Indonesia actually use it. And it's really kind of, they say that it's really kind of helpful, and parent can follow through and have the children to really build the routines, have meaningful activities at home based on the real life experience, which that's what they need. What are the most important that we can do at home? In the first month, most of the educator in Indonesia, they got really confused. Like they just really switch the goal, the curriculum that the children learn at school, and then just send to the house, to the home. Of course, this is not work. So having discussing with the families, have the assessment with the family, what can be done at home to create the activities that natural for the family and for the children, and that really will help the children to build the self-esteem, to reduce the confusion that they have. Empower the family and strengthening the bond among family members. In Indonesia, that mostly a lot of things in the house happening, particularly with the children, become the responsibility of the family. But I guess that even in other countries in Asia, that most of the children living with not only with the parents, sometimes live with the grandparent, and they have some sibling or a brother and sister. But most of the time that they do not know how to interact with the kid. We have to ask ourselves, like, if the children for instance, having a sign language. Does the father can do the sign language? Do the sibling know how to play with our kid? So this thing that it's become our responsibility to empower them, to help them how to share the responsibility so that the children be part of the family. I think that the other thing that is really what we can do is really to support the family to set up the environment from what they have. House, home is not a school. Home is not the institution center where everything being set up to really kind of helping children to learn or help maximizing their sensory. But we still can do things like how to make sure that so that children can easily to take the let's say tools for eating, devices for that thing that they need to eat or they yes, and also can easily to take the food that they need so that the children can be independent. We can do that even we don't have to, we cannot visit the house. We can really kind of do that. Sometime we ask a parent to make the videos through Zoom and really kind of going through the house, and then we could help them like, oh, how about if you try to put this in that place in that site so that the children can find things that they need easily. So this is kind of simple thing that we can do to help the children to accommodate what they need. I think the other thing is really kind of we should develop the goal with the family instead of only us as a teacher or as a CBR worker that really kind of help them to set the goal based on the situation, and also help them how to apply that, how to implement that, because they're not teacher, they're not a CBR worker who knows about anything, and ask them how to support them. Like, is it the using the video is enough, or should I have different ways so that they could apply the goals that actually we create together. Now, what are actually the some challenges that caregivers in Indonesia are actually facing? First, that right now for every family it's really difficult time. A lot of them losing their job, and sometimes that our kid is really not priority. They also mostly have a lot of children, and it's hard for to be them. A lot of families right now also worry about the health of families, and also a lot of them has different responsibility. As a mother, some of them still have to work and earn some money so that the family still can run the economy. But now that they have to also function, to be a teacher, to be a
Hello.
caretaker, to be a CPR worker, or anything that suddenly have to change. And this is not easy. All of them has the multiple roles, as well as father, as well as others. Yeah, it is totally different situation with the institution, school, and other our institution where we have the kid. It has different. Each family has a different facility. Some of our family has a gadget with the internet data, but a lot of them they don't have that. And right now that what we see that if they are living in the city or have the better economic, so that everything could be easier doing using the technology. But if you remember on the map of Indonesia with a lot of islands that really kind of in the remote, and sometimes there is no internet connection. It is also hard sometimes to really visit them. It's not easy. I think that you also facing the same thing. Um, we also learn that our families have a different knowledge um, about their children, and also different knowledge about things that strategy and other things that is necessarily to helping the kid. As we know, all of them has a difficult psychological situation. If I remember, if I really kind of try to ask myself, like I actually, the last time I have a trip was kind of a last of February. Until now, I didn't go to anywhere. And I thought that, well, it just happened like few weeks and then everything will be fine. So I was very optimistic in the first week, first month. But the second month, it was really kind of so hard. Now I think it's really hard for me to maintain if I not going crazy because of this thing. So that's happened also with our families in Indonesia as well. So what can we do? It's really to respect them and respect their priority. Probably their priority is not our kid, but also kind of to help them to integrated what is their priority and also to include our kid into that priority. It's not easy, yeah. And I think that right now is a time for us to really build the relationship, which is really kind of partnership based. We are not one who really knows everything, and family is not one who doesn't know anything. They know about their kid, absolutely, but we need to help them in certain okay, in a certain way. So, and also like help them to build the relationship and bond among them. Like I was saying before, that in Indonesia mostly like only mother does everything, and father only responsibility to earning the money, and do not really want to know about their kid. And this is not supposed to be happen that way. There is a grandmother, grandfather that we can really kind of empower, but really help them. What can they do? How, which part that they could really kind of help our kid. So assessing the strength and discuss what kind of support that they need is really something that is really effectively that we prove it. It's really work for us to help the kid and for them. And how to really kind of deliver this kind of technical support. Often that I found that institution or school only telling the parent of what to do, but not really giving the a sample or demonstrate exactly like what is exactly supposed to be. So not telling, but it's really kind of, we need to work together with them. Ask them, okay, what you need so that your children can eat independently. Shall I give you sample of video, or shall I demonstrate to you? That's something that they really need at the moment, and they are one who really kind of be a key to make sure that all the goals that we discuss and we create with the family really could be achieved. And advocate them, and often that our family is like kind of feeling lonely. With right now with this situation also even worse. So that's connecting with them with other families is something that is really kind of important. And particularly in the rural area, I have a group of a parent that's there are more than 300 parents in the group, and coming from different islands, and they sometimes shock that they want people from the same city in the group, and then they become kind of smaller group in the city, and that is really kind of something that's nice. And okay, my internet is unstable, saying okay. And the last is really kind of be available for them. And sometimes it's not really, the time for being available is not really kind of like in the school. Sometimes like the parent need help like in the evening, in the early morning, but that is what they need, and sometimes we have to be available with that situation. So our recommendation based on our experience here is we put the child and family as first. We are as educator, whatever our role, sometimes we have our own goal, institution goal, the curriculum goal, and this kind of attribute goal that sometimes we think is important. But right now is really kind of the most important is really kind of put the child and family as a first. So and then it's really promoting the partnership to the families, and this is really kind of, we cannot really afford to have the partnership with the families and have the equal collaboration and partnership with the families and the community where the child belongs, as the child part of the, make the child part of the community, part of they families. And of course, before that, a lot of time that we not, sometimes we not recognize what are the resources available. But now is really kind of, it's really kind of big, it's a time. As like today, I didn't know most of you before, but now I know. Sometime maybe in the future, if I need help, I could really kind of connect to you. So it is really kind of some positive thing that I could take out from this pandemic situation, and keep our tracking and keep our work and tracking toward the goals. And like Stephen was saying before, don't forget to take care, taking care of yourself, and have fun with that. Be positive or that. With our situation right now, so we cannot helping others if we're not really kind of in a good shape for ourselves, because that is the most thing that we have to really kind of do for ourselves, and then believe that all the children really can learn. The next slide, please. Including children with multiple disability, and make sure that the children should be part of the family. It is our goal right now to make that as things that we need to accomplish, to make them part of the families and also part of the community. So I think that's the thing that I could say. I hope that it's not taking really long time. Thank you so much for your attention.
Aloka,
Yes, yes.
Again, your mic is muted.
Thank you so much, Wenny, for that presentation. Uh, I hope that at the end of it all, we will be able to combine all of the recommendations and put it forward to the competent authorities. But you were able to take some positives out of this situation, and so thank you for that. The next speaker is Thui, and I hope to see, be able to make a presentation about in terms of, sorry, yeah, this is Thui, and she's the director of the Rehabilitation Center for Inclusion in Vietnam, and the Netherlands Leprosy Relief Mekong region in Vietnam. She has a lot of experiences sharing regarding the problems and challenges that face persons with disabilities in this COVID situation. And she's uh, been trained in many places. She's worked in Oxfam in Vietnam. She has worked in the Vietnam Association for Education for All. And obviously, she has experience while working there. on inclusive education and advocacy and capacity building for organizational members and others. She has also worked in traffic international in Vietnam, where she acquired a lot of experience in wild plant conservation industry and partnership development with government ministries. Um, so I welcome you, Thui, to this webinar, and I look forward to your presentation.
Yeah, thank you
Thui,
very much.
up to you.
Yes, thank you very much, Aluka, for your interesting introduction. And hi, everyone from Hanoi, Vietnam.
Tui, let me come in. Can you speak a little louder, maybe to the mic?
Yes, it's more
Yeah,
right.
yeah, better. Yes, yeah.
Better. What I say? Okay, so hi everyone from Hanoi, Vietnam. It's almost evening in Vietnam, and it's very nice to meet you all, and thanks a lot for the links to give us the opportunity to share with you the situation in Vietnam. But first of all, my apologize for the wrong name of my organization. The correct one should be Research Center for Inclusion. Yes, and Netherlands Leprosy Relief is earlier we are a Dutch NGO, and then we localize, and now we become RCI. So that's why you can see the two name of the organization. So I will start to share with you how RCI look like. So when we become a local NGO, we decide that we still continue the activities that our previous organization still work on. So we will focus on key four areas, that's the research on disability, inclusive education, inclusive health, community-based rehabilitation, and social inclusion. So this is four key areas that ASEAN will focus as a new face of the NGO in Vietnam. Next, please. So regarding COVID-19 in Vietnam, we experienced the first wave in Vietnam starting in 23rd January, and immediately in January, all school closed for by the 4th of May, they reopened again. And then in July, we face a second wave, which start in the center region. But lucky us, we are very happy that for 2 months the government is able to control it, and all the infected case relieved from the hospital now. Currently, sometimes we still have some new case, but most of them travel from overseas. So regarding I would like to provide you some overview of children with disability in Vietnam. We have 26 million. The total population is 94 millions, and of which children is 26 million, and with population with disability is 1.5 million. The government have some policy, but this is the highlight of the policy on children with disability, including the ratification of Convention on the Rights of the Child, and ratification of CRPD in Vietnam, and the law on the children and the law on disability. So this is overall overview of our policy. Yeah, next please. So my talk will focus on two issues. The first one is access to health, the impact on children that regarding access to health, and the second impact is the access to education. So regarding access to health to children with disability, they there are negative impact on children when they do not receive rehabilitation service either at home or office, and in some province the local authorities they interrupt the vaccination schedule, and or they suspend immunization service. So because we have, first of all, the government, they classify province, which one is a high risk, which one in medium risk, which one in low risk. So due to the level of the risk, the government authorities, they will decide either suspend or close the service. Yeah, next please. And in terms of no, please. Yeah, this one. In terms of access to education, Vietnam provide a lot of forms of online learning, including including television learning program, which regularly daily provided to students. But our observation is that it's mostly access to students without disability. And in many cases, learning online only means the teacher giving homework for via online phone for some such as WhatsApp or via Viber or something like that, and give some instruction. And we conduct a research, and the research indicate that during the pandemic, due to closure of school and lockdown and social distancing, children forget knowledge. And in terms of other issue apart from health or education, many children feel very unhappy or boring or even depressed when they are at home, and they hang out with their friend, their peer, without caregiver or parents' permission, and in many cases they get lost. Yeah. And during school closure, children with disabilities, they have more time to watch film or playing game, or they spend very little time on reading book or do their homework and doing their housework or support their parents as well. And the teacher said that many children they break the rule and the routine that established by their teacher. For example, they don't want to go to school again, or they don't follow their parent advice. And because in many cases parents they lost their income and they have to migrate to other place to earn the income, and in this case children have to accompany their children, so drop out is acknowledged. And very serious issue is that when parents have no control on using the internet of their children learn about sex, and they start to imitate. They want to learn it from the adults, and this is we think that is very dangerous for children with disability. Next, please. Next, please.
Yeah, it's coming there.
Yeah, so based on our observation, research results, and discussion, we think that training for caregiver on rehabilitation intervention should be established. And actually, so far we have done a lot of parent training or caregiver training, but we also face some of the issues that not of them can do it properly, or not of them can have a time to practice. And particularly, this is the first time we experience the lockdown of COVID-19. So we still see that further skill for parents during lockdown is still required. And because from earlier we discussed that when children with disability cannot go to cannot receive rehab, it will be influenced a lot on their health. So we think that this is not only the opinion from RCI, this is what we discuss with our stakeholder. So even that is still lockdown or social distancing, it's still possible to get the permission or think of any safety and secure measure to provide home-based care to children with disability. This is our stakeholder already do it. They contact the local authority and explain that they are in good health and safe enough to approach the family, and that the family already give the permission. Because if we skip the rehabilitation for long, and then the situation of health of children will get worse. And we also think that training on sexual reproductive health should be provided. And there are some of the pictures that we provide food support to our children and their family during COVID-19. Next, please.
Processing takes time.
Next.
Yeah, the processing, it's taking time.
Next, please, Chiru.
Yeah, I have already clicked. It is taking time to process.
Hmm?
The internet is taking time to process.
Okay.
I think it's a technical problem. Just wait for a few seconds.
Yeah.
It is there, too. It is there.
Yes. So the
Which slide are you looking for, Latwi? Previous one or the next one?
next slide, please. Next slide, please. This is just some introduction of our activity during COVID-19 only. So
Is this the one?
Yeah, yeah. Next, yes. This one, please. Yeah. And other recommendation is that mapping out the area that children and teacher uh, living, because the experience our experience is that when online, in many cases in remote area, or in many cases children are too poor to have a device, to have a technology device, and then it's better to map out where children and the teacher, maybe not the teacher of the children, but the teacher they live, and then connect. Because then if the teacher live very close to the children with disability, they can come, they explain, and they have the children with disability to learn. And this is very helpful when online is not helpful. Yeah. Next, please. And this is some of the picture. Again, this is some of the picture so that you can overview how it looked like in Vietnam, the class, the school, the jobs of school, and how we deliver food package. Usually we provide noodle, instant noodle, rice, cooking oil, and hand sanitizer and mask to children. So this is some of the picture. Yeah. Next, please. And regarding online, so the government is quickly respond to the situation. I mean, in case lockdown is applied again, the government immediately develop a circular for online learning and teaching. Actually, the circular is still in draft, not is in real instrument yet. But RCI and its stakeholder is participate in different consultation where we provide the finding from our experience. In what way online will be helpful for each type of disability? For example, for the deaf, it really a problem when they learn online when they learn by sign language online. It's not clear for them to see the sign. So so we are still next week we participate, RCI participate again in another consultation, and we submit to the government. However, we and our stakeholder, one of our stakeholder is the National Center for Inclusive for Special Education. We acknowledge that online is still needed. And in that case, and then we should consider different size of learning. For example, one teacher, one student, or smaller group, because the experience indicate that in many cases, one teacher and one student is not workable, because it's give pressure for students. They feel really alone, they feel isolated, and they feel pressure from the teacher, and then it will not work. And at the same time, parents should attend the online learning as well. And other issue with online learning is the interaction between teacher and student with disability should be very visible. For example, the children with disability will keep focused and keep interested in the learning if they, for example, if they can click, if they can touch the button, and when they give the correct answer, and they can see some smile faces, they can see some flower, or if they give wrong answer and ting ting something like that, so they are very happy in that way. So this is the experience that we have, and we hear from our partner. And another solution is that not all, when we deliver online training, not all topic will work with children. So it should be very selective. Some topic we can do online, some topic we cannot, because if children are not interested, and then it will not work. So this is some of the picture that the colleague from National Center for Special Education, they provide weekly online learning, and the picture is very funny and very interesting. And even they can give online instruction for students how to make drinks at home. And this is other picture, home tutoring and students with disability present in the event of the school. And this is some of the hand sanitizer that the students they can put it, they can hang it on the school bag. And this is a class. You see how the class, the teacher giving life skills section to children with disability. So you can see how the class in Vietnam look like. Yeah, next please. So this is all the reference that I put in my presentation. Thank you very much for your listening. It's my pleasure.
Thank you so much, Tui. That was so interesting. Getting examples of the work that you're doing with beautiful pictures of children. Thank you again. And now I will invite Dr. Sudha to make a presentation, before which I would like to introduce her. Dr. Sudha is talking about problems and challenges faced by people in the COVID times. She's speaking from Coimbatore, which is the southern part of India. She is an assistant professor in special education at the Ramakrishna Mission Vidyalaya in Coimbatore. It's in the state of Tamil Nadu. Sorry, I'm looking, yeah. She's has a PhD in intellectual disability, besides having a master's in other subjects. And she has master's in economics and psychology. She has 15 years of teaching experience, and she's been a resource person in various national and international programs. She's also the coordinator in the PhD program of the faculty. And recently, she has co-authored a book on value education and curriculum for children with intellectual disability, for which she received a Best Research Paper Award. Her areas are curriculum development, and these are subjects which we all struggle with, particularly when it comes to children and adults with intellectual disability. Dr. Sudha, may I invite you to make your presentation. Thank you.
Hello. Am I audible? Hello?
Yeah, you're audible. Could you speak a little louder and to the mic?
Yeah.
Dr. Sudha? Yes, yeah.
Yeah. First of all, thank you, Chai organization and the organizers for inviting me to this timely and needed topic of this hour. And also, I would like to thank Ms. Saloka Guha for introducing me to the audience. Yeah, for the last 1 hour, we were listening to, various, the problems that have been identified and we are experiencing through COVID-19 pandemic. Yeah, of course, like other parts of the world, India and South Asian countries are also experiencing this very dreadful disease. And we all experiencing this from almost, see, for the last 6 months, we're undergoing various kind of difficulties and disruptions and so many disturbances we're experiencing in our common life. And especially when you look at children with special needs or disabilities, they had lot of maybe because of their difficulties in the cognitive and functional limitations and other areas of deficit, they also find difficult to cope up with these situations. And especially when it comes to the parents and caretakers of children with disabilities, it is a difficult task for them to cope up with this situation. So we all know that the children with disabilities or special needs, they require, many a times they require medical assistance. And also, so it is a double disadvantage for them. And of course, their regular routines or schedules interrupted, and it is unpredictable. And we are very difficult to maintain. We find difficult to go back to our routines because it is facing such, because we have to face such a difficult situation. And moreover, and children with special needs and also their families or caretakers, parents and caretakers, they're feeling anxious, worried and confused. Even for the normal human being or non-disabled people, it is situation is same. So you forget about the disability. So this is the Indian and South Asian scene during this pandemic. So this is one of the, I took this card from, UNICEF, UNICEF one research report. That is across the globe, we are closing schools, cancelling public gatherings, as you all aware, and closing non-essential government buildings such as parks, museum, and all. So where this is a place where children usually used to, wish to go and spend their time when they find difficult, when they, have some time, extra time and all. So that become that because of this shutdown, so they find difficult to go and spend their time in these areas. And also, according to UNICEF research report, nearly 22 million children from South Asian countries, including India, have missed out on early childhood education in the critical pre-school year due to coronavirus outbreak. This is one of the recent research report which is given by UNICEF. So this is the scenario. So how this closures affected children with special needs? So we all know that government recommended so many criteria, so to follow certain rules and restrictions like social distancing. So which affected exactly residential facilities, therapy centers, daycare programs and all. So we know that children with special needs, they need a day-to-day, before their functional, because of their functional limitation, they have to attend this day-to-day. They have to go to daycare centers and residential facilities and various therapeutic assistance they are in need of. But this is restricted. And this also includes, this is another very important thing that includes staggering meals and activity schedules and limits on visitors in daily screening. So these are the things which they have to undergo, and repeatedly they have to do it. So otherwise what happens, they will either forget it or they find difficult to cope up with the situation. So these are the assistance which we use to provide to such children. And whenever, and also we have seen that when situations where a positive case is identified, but we have to go for quarantine or closure, may be recommended. So all these things, next slide please. So this COVID-19 exactly it really affected child's daily routine such as cleanliness. This is very important point for children with special needs. Cleanliness is very much affected. Eating habits, grooming skills, sleeping pattern, playtime activities, bedtime, recreation, etc. All these things are affected for, and of course, the second point, therapy services such as physiotherapy, occupational, behavioral, learning new skills, and medical assistance. All these things are affected. And also because because we have shifted from the classroom teaching to remote learning, of course. But it is very difficult even for the non-disabled person, I mean people or child itself, it is very difficult to adapt to the new situations. It is then the same is the case with the children with special need also. They have to adapt to the new strategies such as social distancing and no interactive sessions in learning activities and remote learning and all. So they have to adjust or accommodate with all these things. So where is the resource? The sufficient resources are there or not? So this is again a question mark. And what are the remedies it is suggested for to come out of such a situation? That is consistent schedule is very much required. Whether it is a COVID period or other time also, we have to strict on to certain schedule. So like for daily routine, meal time, prayer, play, bedtime and all, we have to keep a proper schedule or consistent schedule and a gradual transition. That is also very much required for according to need and the pace of the child. Because we all know that we value individual differences, right? So according to the need of the child and the pace or the speed of the child, we have to give gradual transition from one activity or one thing to another. And of course, this is another one important thing, use prompts to illustrate schedules and activities. So this prompts, so different kind of assistance we can give them. It can be verbal or physical or modeling or percentage. So all these things we can try at home and give adequate time to complete the task. This is another very important point, that we have to give them proper time to complete particular task or activity. And of course, we have to use reinforcers. We have to encourage them. We have to motivate them for all their small event or success, and timely correcting. This is another important point. Timely correcting or redirecting negative behavior and offering a chance for a redo, because now we all know that we have enough time at home, so we do not know how to use our energy in a proper or appropriate manner. So it is a responsibility of the parents, right? It is a responsibility of the parents or the caretakers to help them to direct in a, very appropriate and a proper manner. So that is also very much needed, because otherwise also children with special needs, many reasons they have deficit in this adaptive behavior or their maladaptive behaviors they may exhibit at different times. So how it can be reduced? So of course, because of this time, extra time with them, so they may seek for other misappropriate or inappropriate behaviors, so which we have to foresee, and which we have to control it, or we have to change it or modify it. We help them to modify it. Yes. Now, how help your child to follow practices during COVID-19? So this is a very common thing which we all aware, that this is not a separate pattern or practice from the non-disabled people. It's the same thing, like washing hands, and when we are sneezing, and we have to cover our nose, mouth and all. And instead of, yeah, this is another important point, waving or giving smiles instead of hugs and high fives. Yes. So maximum we are trying for social distancing. So even in other times also generally we used to practice when during behavior modification time and all. So what we do instead of hug, we try to practice this one, giving social smiles or high fives and all. We can avoid such things so that we can have a social distancing from, I mean, one to another, and helping to clean and disinfect commonly used areas in their home and all. So this is a common COVID practices which we all follow at home. But again, even the children also not exemption to this practice. Actually. So we should help them to follow this thing. That is the idea here. And wearing a face mask at the grocery stores, and whenever we go outside, whenever the children go outside, so we have to strict them to force them to wear mask, of course. And this is another important point: examine child's treatment plan and care needs. Yes, yes, we all know that because now everywhere there is a shutdown of all these therapy centers and all, but we can have their contact numbers or how we can contact them. So, and also we should be ready with a list of medicines which they used to undergo, which they, the medications and the therapy instructions. What are the therapy instructions which is given by the therapist earlier, right? So those things we can have it, so that we can make sure that we have not missed anything, we have not missed any service for the child, and we feel that yes, we are up to date and we can act, we are accessible. And also most, if possible, a form of an electronic document can be kept with us, so that it would be easy for us to share with the doctors, therapists and other service professionals at any time. And so this is another important point which we were discussing. Tui also discussed about this, that is managing stress and coping, staying strong. So stress, this is another very important point. This is not for children with disabilities, even for children with non-disabled also, it is there. So inside the family, how much, because of unemployment, right? One side it is unemployment, one side it is a burden. Many parents feel that yes, because of these children are not able to go to school, they have to take care of all through the day they have to take care of their children. So it creates a tension among the parents, caretakers as well as, so that will augment the child stress also. Yes, of course, when the teachers are stressed or when the parents are stressed, that will automatically, that will shift to the children. So how it can be, how we can come out of this stress, or how we can cope up with this stress, that is very important. So yeah, families, parents and caregivers who care children needs to be strong and resilient. So it will help, or it remember to take time for yourself and doing activities and hobbies which you enjoy, and recognize when you may need a break. Yes, so in between we have to give a break for our activities. That is very important point to come out of this stress. And connect with other family members virtually through video chat, social media or texting and all. So these are very important point. Okay, we may feel that yes, throughout the day if we keep on working or like a machine if we work, so we need a break, right? And how we can connect with the other people or outside the, I mean, family. So these are the, now anyway technology is very high, this is a rough technology, so we all learned how to use all these technologies, and also all these chatting and all we can do. So that is one way of reducing our stress. And take deep breaths, meditate and get some exercise. Physical exercise is very important because we have to release our energy and extra energy and all. And also we should encourage the children to participate actively at the household activities. This is another important point. Even other times also we should use this strategy. We should encourage the children to participate in the household activities. Let it be a small activity, but we should give time for them to do it. Yes. And also you monitor your child's emotional health, very important. Talk with your child about their fears. They may have some unwanted fears or unknown fear or hidden fear, right? So, and let them express their feelings, what they want or how they feel. So all those things we have to discuss with them. We have to talk with them every day, once in a day, at least for 15 to 20 minutes, so that we will get to know what they feel and what they want and how they wanted to do certain activity. And also we should know, we should understand the child, so for which, but we have to spend time with the child, yes. And also we know that one or the other reason all are having but something to say, right? Not every child will react in there would be some reaction, it may not be in the same way, but of course everybody will have something to say about this, yes. Next slide. Yeah, so these are some of the activities we can encourage children to do at home, like we were discussing about self-care activities, which is very important: self-care, motor, domestic skills, and recreational or entertainment activities. Yes. So these are some of the activities. So this is a small experience. I mean, experiment which I have done in my place to know. I mean, with the few families, right? So based on my experience only, I have put up all these points. Yes. So very well, we can practice all these things at home. Yes. Thank you. I think I'm not exceeded my time, or I have time.
You Thank you, Sudha, for all those details, particularly in terms of children with intellectual disabilities. And before we go on to the questions, I'd just like to wrap up a little bit on what all three of you said. And the commonalities first, which is, of course, the impact of routine disruption and impact of schools being closed. By schools, I include early childhood centers, I include other rehabilitation centers. Also, in terms of food, health, education, all of these were diminished in terms of availability, access, and quality. The third thing that all of you have talked about is the exaggerated digital divide between people with disabilities and those without. And many children with disabilities are not able to access online learning. The fourth is the stress of adults, parents, caregivers, mental health issues of depression, which automatically impacts on the child. And Thui spoke about sexual and behavioral issues, and I'm surprised that none of you mentioned abuse, of exaggerated abuse during COVID time, particularly of girls with intellectual disabilities, girls with mental illnesses, etc. Um, Everybody felt confused, lost, battered, and bruised. So, the recommendations that I have compiled from all of what you were saying largely is guidelines for parents for home based learning, which when he shared something that Namita Jacob had developed. It's also available from WHO. They have a parents training manual with a section for those with special needs, and I'm sure most of you have accessed that. Uh, Also important is quick response team that Thui talked about and when he talked about in terms of food, shelter, health, and other rehab measures. Uh, that is probably the most important thing that we need to do. Uh, a lot of home learning videos have been developed over the years for all categories of children with disabilities, and perhaps we should ask Chai to have an open learning system available so that everybody can share whatever videos for home learning that has been developed. It would be a huge help. Uh, Also, you talked about government circulars, and that is always welcome in terms of home-based learning, online learning, and the guidelines for online learning, which is available through the Ministry of Education in India, also from the Department of Persons with Disabilities. These guidelines have been developed and shared. And in terms of gradually learning, it's something we are all doing, and I hope that more consistent schedule development, more routine following, and more commitment from teachers to be more ready to share with parents and with caregivers, with communities, more cooperation and collaboration in e-learning mode. And one of the things Sudha said, which is about behavior supports in terms of positive behavior interventions and support, a consistency with rewards, consistency with finding out what changes are best suited to the children that we serve. I think, thank you so much, all of you, for excellent presentations. And now, if Chiru is okay with it, we will open up for questions. Chiru, is that okay?
Yes, please go ahead.
Do you have any questions? I'm looking at thank yous, lots of them. Um, I have a question, if we can start with that, in terms of in Vietnam and in Indonesia. When he mentioned that a very large number of children with disabilities don't have access to regular schools. Is that true? Would you like to elaborate on that a little?
You're on mute, Winnie. Manish, can you unmute her? Yeah.
Yes, thank you, ma'am. Yes, it is very sad that a lot of children not to school, but also that again that we don't have a data. That's we have a kind of a lack of data information, and then also like um, particularly for children with multiple disability, that really kind of not in school and also not in other services. That what I would say. Also, that the thing is that we don't have kind of strong policy that's stated in our policy about children with multiple disability. It's just recently it's come for the accommodation for children who are in the school, but there is no other things. And even like for the status or in the bureau status, there is no mention about children with multiple disability. So a lot of time that they're really kind of hidden in the community and the several like rural area, remote area, parents or families still kind of ashamed and tend to hide them. Recently that I worked with one teacher that actually not really far from Jakarta, and she found that a lot of children, at least five, that is only in one places, they are being kept at home, and some of them not even being kept at home, but far away from home. It's like really kind of in the inappropriate situation. So that is really kind of our big things. And actually, we just trained some teacher, like 550 teacher, and one of their mission is also to find this kid. And but right now, because of this situation, it's not really happen. If I actually say, we have a kind of strong, let's say, system in the community. If we could mobilize the community to find the kid, actually the system is exists, but no one is actually kind of think that it is their responsibility. So it's a long way, it's a long journey for us to really kind of achieve a dream of having the kids in a school. It's very sad, and that's only 2% of them are in school from our estimation numbers of kids based on the WHO and other resources.
Aloka, you're on mute, Aloka.
Yeah. Uh, I still don't see any questions. Lots of thank yous to Chai and to Ling. But Chiru, if you can see some questions.
Yes, I see one question raised by Charanya, and the question is, can you give tips to encourage regular use of masks for children with autism or sensory challenges? Okay, they find it difficult to wear it when they need. Okay, so when needed. So maybe Dr. Sudha, if you can answer to this question.
I have a doubt that Sudha and Tui has left. I think they have left the meeting.
Okay, I have another question here about what is the situation in terms of societal awareness about special needs in Indonesia. Um, are you sure they've left? No, Wenny is here. Wenny, would you like to answer that, please?
Yes, actually, I have some experience related to that. A great question that actually we're also facing, because a lot of our kids, they also kind of not really comfortable to have something attached to them. So what we want when we discuss with parents, that first is really kind of using the try to teach using the mask when during the activities that the child really kind of like, during the favorite activities. So we have a lot of children who really kind of love to ride the motorcycle. So that is also the time where we parent actually ask the child to introduce the mask, even a very short time in the beginning. And then the other thing is also kind of to use the social games among the family, and integrate the mask as a part of the story, and also really kind of try to teach that. The other thing is also kind of some parents using teach the child and use the activity that they like as a reward when the child really kind of able succeeds to wear the mask for a certain time. So I think that these are the things that and our experience has really worked for our kids. And Madam Aloha, I was sorry, I lost with your question.
In terms of inclusion, the question is for you, Winnie. In terms of inclusion, what is the status? It seems to come across as uh, nothing, but Are there schools who admit children with disabilities, uh, very high functioning ones, at least?
Yes, yes. So if we talk about the children with single disability
Mm-hmm.
or with the higher function,
Mm-hmm.
yes, a lot of them are in school. And sadly, when we talk about relate about the inclusive education, that children who are higher function, they're supposed to be in the regular school with the support, right? But because of some situation, and they really kind of a lot of, kind of overlap or mismatch the policy, and the special school tend to keep the children who are higher function in their school so that they could attend different competition and those other things, so that the children with multiple disability really don't have the space to be in the special school. And also, like, the teachers still think that it's really hard to work with this kid. So yes, we have a lot of policy, a beautiful policy, but always that the implementation is always different.
Yes. Yes, that sounds very familiar. So,
Aloka, can
yes,
I come in, please?
please go ahead, Father.
Angelic from Lillian Fonts have asked a question. I think she also may have something to contribute. What she has asked is regarding masks for children with autism and sensory challenges. Do you use social stories? Some are available connected to COVID, including mask use. Probably she may also have something to say. So can somebody answer that question about using social stories or masks, using masks? Aloka, you want to mute?
Okay. Um, I would have liked Sudha to have answered this question, but yes, stories are, of course, the best way to explain to children with autism in measures how and why and for how long and where to use masks. Similarly, with hand washing, there was a time when people who wash their hands very frequently would be called OCD, obsessive compulsive disorder. But now that is the new normal. So, yes, I, I feel children with multiple disabilities, children with autism, are probably the most badly affected because of the routine disruption and the schedules that they are unable to understand. But yes, we do use a lot of social stories, we use visual schedules, we use task analysis in trying to explain why and how to continue with a routine at home with lots of breaks in between so that children can do their preferred activities in between tasks that they don't like doing, and a lot of phone calls with the teachers and the caregivers to stay connected in terms of socialization. And but that's is a part that everybody is missing. But whereas sometimes we understand why it's missing, it's not always possible to explain the larger picture of COVID to children who have more profound and more severe disabilities. But to answer your questions, yes, we do have social stories, visual schedules, task analysis, and a lot of rewards for doing the right thing at specific points. But I do know of mothers who use cooking time to teach maths. You know, three potatoes and two bindis and or two pieces of cauliflower. What do they mean? And if they answer right, they get a few potato chips. So whatever teachers know, they are sharing, and I think the biggest positive out of COVID is collaboration, learning how to share what we know, and learning that no one, no single person is an island unto oneself. But unless we collaborate and cooperate with parents, with other teachers, with other rehab professionals, and build our own knowledge, we will become irrelevant.
Okay, Aloka, can I come in, please?
Please go ahead.
Yeah.
Shall I unmute? Yes.
Yeah, some noise was coming. So it is 4:50 already. We have crossed the time a little bit, but there's some interesting chat going on here. I can see Angelique speaking something about social stories. So maybe we can, if there's an input, she can speak for 1 or 2 minutes. And I could see one sister, Dr. Lourdes Mary, chatting a lot about this social stories.
She's
So
from
they're
Trichy.
all from the Grassland.
Yes.
That's just, one of them probably will be handling children with disability, and Angelique, I'm not sure, I think she's an advisor in Lillian Fonds. So should we give them 2-3 minutes to speak? What do you think, Aloka?
Absolutely.
All right.
We will
and then probably, since it is already time, maybe with that 2 interventions, probably we should wind up, move on to the vote of thanks. So Manish, could you please unmute Angelique from Lillian Fonds? Angelique Kester.
Yeah, I given permission.
Yeah. Angelique, could you please come in? And if you could pin her, we can also see her on the screen. Yeah. Angelique, could you, I think you have something to say about this, social stories?
Yes, thank you very much for unmuting me, and thank you very much for organizing this. I think most was already shared about the social stories. It was something that came up in other webinars as well, because we heard in many webinars that a lot of families have difficulty motivating their children to wear masks, to wash their hands and things like that. And I know that they also advise to use social stories, so like a booklet that they can go through to explain how that looks like, what is needed. And I know that recently from the IDDC network, they also shared a special social story that was made around COVID. So I thought maybe that would be interesting if we can, because I can imagine in many countries there are different tools that are being developed and made, maybe in local language or in English. It would be really nice if we can share that together and maybe use if people want to. That is yeah, what I wanted to.
Thank you, Angelique. Thank you for that intervention. Manish, could you unmute Sister Dr. Lourdes Mary? I think she will bring some experience from the field. Sister Dr. Lourdes Mary, could you please?
Yes, Father.
Yeah, please unmute and come in. Could you pin her, please, Manish? Yeah, sister, please go ahead.
Yes, Father, thank you for the opportunity. Yeah. I just want to tell the participants that the children with autism are very good at imitation and they learn very fast. So they can be taught to use the mask, use the sanitizers, washing hands, everything can be very easily taught to them. And as Aloka ma'am said, the structured way of teaching them also is very good. The reinforcement that we use, no, that also enables them. It's a very good way of teaching the children. And we have succeeded in our own institutions. We have children, around 55 children. Now with online, we are teaching the parents. They are able to practice it. We have a school called Nest in Trichy, run by the Sisters of the Cross of Sharon. We are known as Holy Cross Sisters. I think you may be familiar. We are working in 15 countries all over, and we have a department in the Holy Cross College, Rehabilitation Science and Special Educations. Right now, I'm heading the institutions, and I advise her to both the schools, Blossoms and Nest. So we are in good contact with Aloka ma'am. I was so happy to listen to her, and Sudha ma'am and all that. Thank you, Father. So it's a very good initiative. on Pataxi.
Thank you, sister. We have a limited time, otherwise we would have given you more
Okay,
time.
so okay, Father. Thank you, thank you.
Thank you for the intervention. Alok, there is one Sainab who had been raising hand consistently. I think it's maybe from some other country. Shall we give that person also last intervention? Sainab. Manish, could you unmute, sign up? That will be the last intervention. And pin him.
Yes, good evening, everybody. Thank you for this wonderful session. I'm actually from India.
Sorry, sign up, we lost your voice. Yeah, please.
So I am actually from India, and I actually work for a library which is global, which is called Bookshare. I just have an input to give that this library has 9,028,000 books only for people with disability. And there are the membership for countries like India, it is completely free. And we are working only for making books of education and pleasure reading. Now, since Corona is on, we are making all those books available for people with disability only to read, like autism, learning disability, and such type. And there are children's books which are over 75 to 80,000 with images for people who can see and without with a image description, sir. So, Father, I would like to just say that when this facility is available, why should people not use it and reinvent the wheel for education? We have actually designed the complete syllabuses for most of the states in India. We have um, a lot of books which can be read on a simple Android phone. Once you download the book, it's hardly even smaller to a WhatsApp chat. So once these books are given to these children, it's downloaded, it's there on your phone, and it's in KBs, it's not even in MBs.
Thank you, Saina. I'm so glad that you raised your hand, and this intervention is now highly valued, and we noted it. Which part of India are you from?
I'm from Maharashtra, Pune.
Okay, so you're working there, and it's just a personal question out of curiosity. Do you also have a disability?
Yes, I'm a person with disability. I'm a person with vision impairment.
Okay, that's amazing. So thank you so much for your intervention. Alaka, I think we will have to slowly start landing and winding up because we
Thank
have
you
crossed.
so much for giving me the opportunity.
Definitely, we'll get in touch with you, sign up.
Sure.
Your intervention is excellent. Okay, thank you.
So, time to say thank you to Jai for this really excellent opportunity to share. Thank you, all the speakers, and thank you, Father, for the interventions that you kept making on the way. I've already wrapped up, and I just want to say to everybody, let's keep in touch. Thank you very much.
Alaka, there is a formal vote of thanks. Maybe we need to stay for that.
Yes,
Well.
yes, yes. And I would request Mr. Ranito Sorongen, who's program manager for Northville Foundation Philippines, to give a vote of thanks. And he's the chairman Committee on Children with Disabilities and Council for the Welfare of Children in the Philippines. Please, Mr. Sarangan, go ahead and give a vote of thanks, official one.
Yeah. Good afternoon and good evening to those from the Philippines. Yeah, we want to acknowledge now the support of Liliani Funds, the initiative of Link Asia, especially Father Matthew, the other members of Blink Asia. It's really a pleasure to initiate this kind of webinar. This webinar helped a lot, especially those who are present at this time. This maiden webinar will lead us to more webinar, to capacitate, to empower professionals, and maybe later on, parents of children with disabilities. And ultimately, maybe we can invite children with disabilities themselves to speak about the experience during this COVID-19. So once again, thank you very much to our moderator, to Liliani Fund, to all our esteemed speakers, and those participants who stay with us until the end. So once again, thank you, good afternoon, and good evening. See you all next time.
Okay, Aloka, shall I take over from here?
Please do.
So thank you so much, Ranil. Ranil is a great friend and also part of our Link network, and he made the word of thanks sweet and short. I think with that we should conclude this meeting, and I really thank you, all of you, for making time for this. Thank you, Aloka, and also the speakers. Veni, thank you so much. And a special thanks to Chiranjeevi. No, we call him Chiru. He is the coordinator of Link Asia, and he's the one who really went out of his way and did this. And I think it was a great success, and we look forward to the next webinar. Stephen, thank you for all the support, and also Willie. I can see Willie there. Yeah. And Ranjit, yeah, JBS is also part of the Link network. So thank you, all of you, and thank you, Angelique, for your intervention as well. Okay. Well.